welcome to our June segment of the Women's Ignite Network here at Anointed Community Services. And we're so happy to allow you to come in and to join us with Dr. Barbara Unsua, a medical doctor who gives us health and wellness tips for the mind, body, and spirit. So the next voice that you will hear will be that of Dr. Barbara. Sit back, get your notepad, take notes because you would want to keep this information in order to help you become more healthy and well. God bless you. Enjoy.
Hi, ladies. Good evening. This is Dr. Barbara again, and we are here to talk about health and wellness. Today, we are going to talk about various cancers that affect women and how we as women can be empowered to prevent those cancers in our lives. There are methods and screenings that are used for the various cancers, and that's what we will discuss today. So get ready. So, like I said, we're going to discuss a number of cancers that are common in women. Research has shown that there are certain ones which are very common in women, and these include breast cancer, cancer of the colon and rectum, skin cancer, cervical cancer, cancer of the womb or endometrial cancer, and ovarian cancer. Now, as you may know, cancer is the abnormal growth and multiplication of abnormal cells which form in any organ. And the top three that are found in women mostly are breast cancer, lung cancer, and colorectal cancer. Like I said, that means the colon and the rectum. And these three account for over 43% of all cancers in women. So prevention and screening are the keys to early detection and reducing the incidence of these common cancers. Now, if we're going to talk about reduction of cancers, we need to talk about risk factors. A risk factor is a condition or a factor that makes one susceptible or prone to a certain disease. And in this case, we are talking about cancers. Now, the interesting thing is that some risk factors are fixed. We can't do anything about them, like your age, your inheritance, and your genes. Okay, but some are also what we call modifiable risk factors, and these we can do something about. And that is what I want to concentrate on today. Now, for the modifiable ones, they found out that certain things help us to modify them. They include healthy life choices and immunization and also early screening. Okay, so first of all, we'll talk about healthy lifestyle choices. The first is healthy eating, and this includes eating fresh or canned or frozen fruits and vegetables, nuts, seeds, beans, and diet which is high in fiber. For example, if you chose a whole grain alternative, for example, bread instead of white bread, you're getting more fiber. And that helps in even preventing some cancers. And we'll talk about that a little bit later. But they've also found that diets which are plant-based, and when they say a plant-based diet, they don't mean that every diet has a plant in it. It just means that majority or 2/3 of your diet is from plants. They found out that plant-based diets helps they have anti-cancer effects because they have anti-inflammatory effects, and they're also rich in antioxidants. I'm sure you've heard about antioxidants. And so all of these can help reduce the incidence of the three cancers we mentioned before and other cancers: cancer of the rectum and the colon, the esophagus, even the mouth, the larynx or our voice box, the lungs, the pancreas, stomach, and the bladder. Studies have also shown that people who eat low um, diets which are low in plants and in fiber, they tend to have a higher incidence of cancers. And so the more fruits and vegetables, the less likely you will end up with some of the cancers we discussed earlier on. Now, as you realized, we had mentioned lung cancer, and so I want to talk a little bit about that. Smoking and other tobacco products need to be stopped because that is one of the lifestyle changes that one has to do. It is better not to start at all. They found out that nicotine, which is present in tobacco, in e-cigarettes, those who chew tobacco, all of this has nicotine, and it causes an increased risk of cancer of the lungs, the mouth, the esophagus, which is the gullet, the throat, and the larynx or the voice box. So all of these are affected when people use nicotine products. Now, people don't realize that, but nicotine is one of the most addictive substances on earth. So it's better not to start at all. And some people, in order to stop smoking tobacco, they tend to e-cigarettes. But e-cigarettes also contain small amounts of nicotine, and it's actually supposed to help you transition to a non-smoking status. But unfortunately, some people get addicted to the e-cigarettes because they have different flavors and so on, and they also have the nicotine. So in the end, you may be inhaling more nicotine using e-cigarettes than if you were using cigarettes, the normal cigarettes. So the good thing is that help is available if you are using tobacco products or smoking. And it is through medications, nicotine replacement products to start off with, and then you are weaned off those, acupuncture, and smoking cessation counselors. For example, in Florida, there's a 1-800 number you can call, and you have counselors who can help you through the period of craving, and they'll give you tips to help you to quit. So, smoking is the #1 cause of lung cancer. Unfortunately, some people do not even smoke themselves, but they are subjected to secondhand smoking. So, please, if you live with somebody who smokes, let them smoke outside of the house. Encourage them to quit and help them to quit. Because if you are in contact with that person, you inhale the smoke and you end up with tobacco related diseases, including COPD, chronic bronchitis, and even you may end up with lung cancer when you actually did not do the smoking. The US task force, which recommends uh, preventative measures for different kinds of cancers, has put in place a screening method which people who have smoked more than heavy smokers who have smoked a lot can go and have this test done once a year, starting at the age of 50 to about 80. Once a year, you go for what we call low dose CT scan, and that would show whether your lungs have been affected by the nicotine and the smoking. Now, these are usually covered if you have insurance. So, talk to your primary care doctor about this. Now, the other things that we can take control or charge of that can help us prevent cancer are exercising and weight loss. With obesity, and that is having a BMI of more than 30, and we all struggle with it. Okay, so, but we have to try and do something. It causes increased risk of endometrial cancer, which is cancer of the womb, breast cancer, cancer of the esophagus or the gullet, okay, stomach cancer, liver, and pancreatic cancer. So, what we need to do is to exercise to help us not only to lose weight, but to also give us many other benefits. And one of the benefits is it lowers the risk of cancer. And those were the cancers I mentioned initially. It decreases the risk of endometrial cancer, breast cancer, and again, colorectal cancer. It does this by reducing the levels of certain hormones in our bodies. It also, of course, exercise will help us to lose the weight and decrease the cancers that I mentioned earlier, which are associated with obesity. And one thing that exercise does is that it helps food move through our gut, okay, so that uh, any toxic substances that we've ingested is not in contact with the large bowel for a long time. Because when there are toxic substances in the large bowel, it can easily lead to changes in the cells in the large bowel, leading to abnormal cells and eventually cancer of the large bowel. Alcohol is the other thing which is associated with cancer. And I tell people that, especially for you who are believers, our bodies are the temples of the Holy Spirit. And so we have to be careful about things that we put in our bodies. And those who drink alcohol a lot have increased damage to certain cells that can turn into cancer. This includes cells in the liver, and then also because it moves through the gut, it causes, you can also have cancers of the mouth and breast as well. So let us avoid alcohol. And women who drink more than one serving of alcohol a day are at increased risk of alcohol related diseases. Now, the next one that I want to talk about is what all of us tend to be concerned about, and that is breast cancer. There is a way that you and I can make sure that we do not uh, get breast cancer, or that if there are abnormal cells in our breast, that they are detected early. Early detection is a key to early treatment of breast cancer. And so the one which is the gold standard is screening mammograms. And that leads to early detection of breast cancer and early treatment. Now, different organizations may tell us different times when the screening should start. But for the average person, most of the organizations will, and I'm talking about the medical organizations, would say that you can have your baseline screening mammogram at the age of 40. Now, for those who have what we call dense breast, and this is detected when you have a mammogram, they do encourage those people to have MRIs of their breasts as well, apart from their usual screening mammogram, because MRI of the breast is able to detect things that the screening mammogram may not be able to detect. And also, if you have a strong family history of breast cancer, MRI is recommended. And when we talk about family history, a lot of us think that, oh, my mother never had breast cancer, my grandma didn't have breast cancer, and so I don't have to go for screening. Well, I'm afraid you're wrong, because it's only 15 to 20% of breast cancer that is caused, that has the risk factor of family history. So it is important, whether you have a family history of breast cancer or not, make sure that you do your mammogram screening tests. Okay. Now, the other thing that could also be used or is useful is when you have your breast examined by a clinician, a doctor, a nurse practitioner, and they can do that when you go for your well woman exam. Although some medical organizations think that by the time that a breast cancer is felt by the hands or the fingers, it is probably big in size. I normally encourage people to have the clinical breast exam done and even to do self breast exams. And the reason is that um, some people may be living in other countries where mammograms are not available or they are expensive. And so when they do self breast exams, they can know what their breasts feels like. And so if something appears, then you can go straight to your doctor and ask your doctor to examine you. And so there are also some gadgets that are available. Some of them are called uh, breast light and so on. They're all on the internet, and some people buy them and use them to help with their self breast exams. So, cervical cancer prevention, I think we had discussed this previously, so I'm not going to spend too much time on that. But most cervical cancer is caused by the human papilloma virus, okay? And this is a virus, and it is transmitted sexually. And so it is important to have your pap smear. And nowadays, together with the pap smear, they do what they call the HPV test. And that is able to identify if you have the high risk human papilloma virus that is associated with cervical cancer. The good thing is that there's also immunization against the human papilloma virus. And before, it was younger people who were advised to do that. But right now, women up to the age of 45 can have the human papilloma virus vaccine, and that will prevent breast cancer. Sorry, cervical cancer. So it's important that you discuss this with your doctor. Now, last but not the least is colorectal cancer. I mentioned it earlier on, and there is ways in which you can go for screening. Now, the American Cancer Society is now recommending that people start screening for colorectal cancer at the age of 45. It used to be 50 and above, but now it's 45. And there are 6 screening tests available. Okay. Most of us have heard about colonoscopy, but there are others. There is a stool card test that you can do, which detects blood in the stool, and that means then you need to go for a colonoscopy. There's also another stool test, which is more accurate. It's called the FIT test, FIT, and that also detects blood that is specifically from the large bowel. When that test is positive, and the good thing is that test can be done at your doctor's office. It's not expensive. And if that detects blood, then you have to have a colonoscopy, because with the colonoscopy, they are able to look into your whole colon and rectum, and then they can see if you have any polyps that the gastroenterologist can remove while he is looking into your gut with a camera. Other ones include stool DNA, and that is a very good test, because what it does is it detects abnormal DNA, okay, and it also looks for blood. So that is more accurate than the FIT test I mentioned earlier. Of course, when that abnormal DNA is found, you need to have a colonoscopy. Other tests which are not as prominent is called a barium test, where you have to swallow some contrast and then they take a picture of the intestines. And then the gold standard, which I mentioned, is the colonoscopy. Now, if you have health insurance, most of the time they will cover a colonoscopy. You may have to pay something out of pocket, but I think that it's worth it. Now, if you can't afford that, and you go and see your doctor, at least they can order the fit test. And also, there's also another test that is used, which they can also order, and that would also show you whether there is blood in the in the stool. Okay. So, in conclusion, you and I, have the power to prevent many cancers, and we have to take screening tests very serious. Most screening tests, also known as preventative tests, can detect cancers at an early age, before at an early stage before symptoms start. And for women, breast, colorectal, cervical, and lungs are the ones we should make sure we have done. But the first three, with the lungs, if you are a smoker or you've been exposed to secondhand smoker, that's when you may have to have that test done. Talk to your primary care doctor about these. And it's been a pleasure being with you again this month. God bless you, and we will meet again next month. Bye.
Recording. All right, all right. I hope you all enjoyed Dr. Barbara and the health and wellness tip for the month of June. We invite you to join us, the Women's Ignite Network, for the month of July, as she will be coming back giving you much more tips on how to keep yourself well and healthy in spirit, soul, and body. Once again, we say thank you for joining us. God bless you.